Welcome. Hi, I'm Wanda Williams, Solano County Supervisor, District 3, and I just want to welcome you to an amazing seminar. Our seminar focuses on Black maternal and infant health, and it's called Healing Our Future. I'm so excited to share with you some of the clips from our event and let you know how important it is for resources for Black maternal health and infant health is really being distributed out into the community. I hope that you take away from this seminar that you feel empowered, educated, and ready for advocacy because we have to get out there and advocate for better health outcomes. Enjoy.
All right. Hello, everyone, and thank you so much for coming out on this rainy Saturday. It's so great to see so many chairs filled and to support such an important topic, and that's our Black mothers and our Black infants. And so my name is Dr. Fuller. I am the Maternal, Child, and Adolescent Health Medical Director, as well as Solano Hills Facilitator. And I would like to invite our panelists to come on up, starting with Dr. Braden. Come, I see you sitting over there. And do we have Lisa Davis? Can you please join us? And Melody Martin. Can you please come on up? And I'm going to let each lady of this dynamic panel give a brief introduction of your name, and we'll start with Dr. Braden.
Hello. Good afternoon. All right. I'm Dr. Gina Braden. I'm one of the pediatricians who work for Solano County Family Health Services, and I'm very happy to be here today.
Hi, my name is Lisa Davis. I'm a certified nurse midwife who does home birth. I live here in Vallejo, and I serve Vallejo, Sacramento, San Jose, and all around the Bay Area. And I'm passionate about having Black families access home birth.
Hello, I'm Melody Martin. I am a registered nurse. I am the nurse director at Kaiser Vacaville Family Birth Center. So my role as the nursing director of the Family Birth Center, which is labor and delivery, the NICU, and postpartum, is I collaborate with obstetricians and midwives to ensure the actual clinical outcomes of these moms and also your actual experience that you have in the Family Birth Center. So when I answer my questions, I'll be speaking from that space of when you're actually in labor and delivery and what you could do to advocate for yourself.
Thank you so much. And we're going to dive right into our questions. And I want to point out that we're going to be talking about this issue and some of the data and some of the outcomes that we're seeing, but we're going to also be looking at what we can do about it, what changes that we can make, and as you said, how we can advocate for ourselves and for our patients. So with that being said, our first question is, you know, in Solano County, we have a quarter of our pregnant women who don't have access to prenatal care during their first trimester. We also heard and we know that Black women are dying in childbirth at as high as rates as 3 to 4 times those of white women, and that's true here in Solano County. And that Black infants are dying before their first birthday twice as likely as white infants. So with all of this in mind, what are some key factors that contribute towards these disparities and poor outcomes, in your opinions? And we'll start with Dr. Braden.
Okay, poor health outcomes. I'm also going to be speaking in the frame of a pediatrician. So although I have some experience before, obviously the pregnancy has the baby, to my office. There are some things that I have experienced and some things I have not. But as far as the question is concerned, I believe that first comes to access of healthcare. I found that a lot of my mothers, before they come to see me, if they have told me that they haven't received the full 8 or more visits that is expected for during their pregnancy before they gave birth, a lot of the reasons they came in to say that they did not receive that care is because they did not have insurance. And when they, my first factor that I would express is that it's important to make sure that women before they are pregnant have a primary care physician. They need to have someone they trust, whom is already established in their lives and know what's going on in their world, and are able to advocate before birth. Many women don't realize that if they are sexually active, they should be, and even if before they are thinking of getting pregnant, they really should be taking prenatal vitamins. They should be preparing their body for the birth. Before they know they're pregnant, they already have a neural tube. The baby already has a brain stem and brain of development. And by the time they figure it out and they start taking prenatal vitamins, it's too late. So it's important that before they are going to be pregnant, that they're seeing a doctor regularly. And the second thing I would say is that factors that are really high in the importance of this is that they need to have more primary care doctors. There isn't enough primary care doctors in usually the environment where most of our community, African American women, are living. And right now the shortage is very clear. I see it even at the pediatric level. I am getting numerous new patients, and my schedule is backed into 3 months, and I can't sometimes deal with the overload. There's a lot of need, but there isn't enough providers available.
Thank you, Dr. Breen. Excellent points, especially with the prenatal vitamins. And we wish we had, we could clone Dr. Braden and have many of you in our senior children. Lisa, would you like to answer the same question?
First, I'd like to give a land acknowledgement. We are on the unceded territories of the Patwin, Sassoon, and Ohlone and Bay Miwok tribal lands. And I think it's important to acknowledge the land that we are privileged to be on, and the ways in which colonization has affected indigenous people of this land. I have 25 years of experience. I started as a med-surg nurse, did that for a couple of years, and I was a labor and delivery nurse for Kaiser. I started in Kaiser, San Diego, and then I moved back to the Bay Area. I'm from here. And in 2004, and I worked at Kaiser Oakland until I retired a couple of years ago. And meanwhile, I was becoming a community midwife as a certified nurse midwife. And so I'm speaking in that reference of many births. I would like to, so we've known that structural racism, individual racism, structural racism is the cause of disparities among our people. And that study actually came out in 2011 when a lot of the hospitals did not want to acknowledge or admit that issue. A lot of the people that I've been working with for years have been on the ground trying to get that information out to the people so that we can do something about it. And the turning point was when the study came out that affluent Black women, educated, healthy Black women fare worse than poor, overweight, white women. That was the turning point, because Everybody wanted to do something about it then, because people with money were like, wait a minute, that can't be me. Yes, that's you. Because a lot of us who got our education and struggled through the systems of education had to weather a lot of racism to get where we are. And it has affected us mentally, emotionally, spiritually, and physically. And there is a book that is called The Body Keeps Score that really talks a lot about that. So our bodies are tired. And so it's not just disparities, you're poorer black women. And when it was just poor black women, nobody really wanted to talk about it. But this problem is age old. So what structural racism plays out in the way that doctors are trained, the way they relate to patients, the way capitalism affects healthcare, profits over people, the lack of respect that folks that comes from these institutions for people who are the most effective, and for midwives who serve the community and who are experts at normal physiological birth. And I would like to say that midwifery is not without its fair share of intense racism as well. The midwifery community is 95% white, and most midwives work in hospital systems, and our birth statistics are trending way worse than they were 10, 15, 20 years ago. It's now safer. It is now safer to have a baby in slavery time than it is to have a baby right now. And we have midwives in the hospital. So there is a history of shutting out black midwives, and that history is current. So, so that's what structural racism looks like. It looks like the shutting out of the people who actually know how to solve the problem, and having a top-down approach instead of a community-based approach to solving the problem. For people who come in probably at the 9th inning who weren't really aware of these things that were going on and who are now wanting to fix the problem. And so I want to say that with all the money now being poured into Black maternal health, that community midwives see none of it. But our resource and our information is what is being used to make the change. And so a doula, which has its foundation, the word doula actually is a racist word. It means birth slave. So a lot of us won't use it. We'll call ourselves birth workers or birth supporters or birth coaches. The word itself is, white women came up with that word. But we've been doing that like a lot of it, like I was a birthing project prodigy sister friend back in the day. That's what you would call a doula. Back in 1994, I was supporting women in birth before I even became a nurse. And so pouring money into the problem has not and will not fix the problem. You gotta start listening to the people on the ground.
I think she did speak on it very fluently and very impactfully of the inequities in maternal health. But just like the point was also, we also have to be the faces in the hospital system. So some statistics in the 1980s, as far as nursing, we only made up like 3%. In the 1980s, RNs were 95% white. Currently, right now, the RNs are 85% white nationally. I did some statistics for Kaiser Vacaville for my specific department with labor and delivery nurses. We are 65% white, 9% black. We have to also be the faces. I don't have the statistics as far as obstetricians, but we also have to be integrated in there, and just like for me in the leadership role, also be part of that landscape to make these changes. One thing I do feel we have to do, we know it's structural racism, but we also have to now, there is a Senate bill that was enacted in California, SB 464, and it's dignity in pregnancy and childbirth, which requires healthcare systems to address the inequities. But the first step was just implicit bias training required every 2 years for clinicians and staff and nursing. But we have to go a step further. So there was a conference in Lake Tahoe, because California is actually leading the nation with our numbers and the actions that we do to address inequities. And there was a conference, and the conference was actually titled, okay, we now need to get past implicit training. What do we do next? And so from my perspective, when even I'm stratifying my data in my department, okay, what do I do with that now? Here's my data. Here is the mortality rate of black women that deliver in Vacaville, but what do we do next? And it's also that, talking about pouring the money, or where's the resources, or how do we generate the resources to then give these huge healthcare organizations that space to actually then do the research. Okay, if we presented in the exact same socioeconomic, same disease process as non-black, why is my mortality rate still lower? If we still have, if we address the structural racism, if say it was a department of all black RNs, and we still have the same mortality rate, then there needs to actually be some scientific study, which that is a sensitive subject, of well then why? And then I know you also referred to it's ACEs, adverse childhood events, and how does that structurally affect you at the cellular level? And so there's still a lot of work to really figure out why we have the inequities.
You can. Thank you. What amazing information we got just from the first question. I learned a lot, and what I heard you all say is there's a lot of factors that are contributing to this. One being structural racism, and also what do we do about this? How do we better leverage the funding and the policies and the systems changes? How can we leverage that so that we can make a difference? Okay, let's welcome our panelists back. If we can have everyone come and sit. Thank you for your patience. If we can have everyone come back. We're about to start or continue our panel discussion. So we left off with some great information, talking about some of the factors around the outcomes that we're seeing with our mothers and our babies dying in childbirth. We've learned some really great, interesting facts around doula and the meaning around that. And also we started to talk about what can we do next. So our next question, I would like to ask Ms. Melody Martin. What are some red flags or warning signs that you may be getting treated differently or not receiving equitable care?
Yes, great question. Like I said earlier, I'll speak from the hospital setting RN. So red flags, if you are not being involved in your care, if things are being done to you without explanation or even giving you choices, if you're asking questions and they're not being answered, those are big red flags. But the first point I said was you're not involved in the care, because we really strive for family-centered care, and talking from the hospital, we say the patient involvement. When you start your journey in pregnancy, there's a birth plan. I can speak to my organization. One of the first things we do is we print out your birth plan that's in your medical record. The nurse and the midwife go over your birth plan. It's posted on the wall. And that's your first step of being involved in your care. Speaking as an RN, just like Supervisor Wanda Williams said, is nurses are advocates. No matter what race your nurse is, if you're sitting there in that room or you have a daughter, a friend, and you tell them that the nurse is your advocate, you look your nurse in their eye and you say, I need you to advocate for me. And I guarantee that will wake that nurse up. And so the red flags is really you're not involved, questions aren't being answered, things are being done to you. But one point with the red flag or warning signs is, well, what else? And that's the education part. One thing I can speak to from being in a nurse leader is getting your education and information from the right sources. Too many times we hear about Twitter, mom groups, social media, Dr. Google. When you're going through your prenatal care, or even if you have access, ask that provider, midwife, nurse, anyone in that clinic, what sources, where should I actually be getting my information about the type of care I should be receiving? And it should be scholarly sources. Even if you right now Google nursing associations, obstetrician organizations, pediatric midwifery organizations that are accredited, that's where you want to get your information from. Because we find sometimes when we do meet patients at the setting, at the bedside, it's misinformation, and then the fear comes up from both ends. And so be knowledgeable, so then you know those warnings, signs, and then also if you're not part of the care and you're not getting any questions answered, and also another point from the experience level is if you feel like you're being isolated, alone, or dismissed. One thing we pride, and we know that we also teach our clinicians, is being at the bedside. If you have someone that's running in and out of your room, you can ask them, sit down. I want to talk about what we're doing next. I want to talk about how I'm progressing. I want to talk about that high blood pressure. Why? Well, what do we do? If you feel like that person is just always going to the door and trying to leave.
Lisa, do you mind, do you have anything you want to add to that question?
I would just add that oxytocin is a hormone produced to stimulate contractions. It is also the hormone that is produced when you feel loved, safe, and secure. Therefore, fear-based anything has no place in the delivery room. And it is a huge red flag when someone is threatening you with, if you don't do this, your baby's gonna die, or coercing you to do a procedure that you feel strongly against, or doesn't take your no seriously. I have seen so many doctors use threatening tactics to get a patient to do what they want them to do when that patient really does have a choice. And it really can stop your labor, puts you at higher risk for C-section. And so that's the only thing I would add as far as that.
Thank you. Dr. Braden, what policies, hearing all of this and hearing the issues that we just discussed, what policies or changes can be made in the healthcare system that can make it less dangerous for people of color?
That's a very difficult question. I am not at all in the frame of making policies or in that frame. I really wish I had more knowledge, but I would think that, having someone in particular to stand in the gap, it's important when anyone is sick, they come to see the doctor. That they have someone who is not sick, who is level-headed and who can advocate for them, not belliger, not, on the other side, threaten, but to strongly advocate for them. Sometimes it comes in the form of the midwifery or the doulas, as they are called by some. They can stand in the gap, and those kind of persons or policies that allow for someone to be held accountable as well for whatever their actions are important.
Thank you. Melody, would you like to add anything to that?
In reference to policies for inequity of care, it's groups like this where there's actually people who can make political action. Where for healthcare systems specifically is if policies are created through our regulatory and accrediting bodies such as Joint Commission, CMS, and GACH, and those bodies are actually who survey us and extract data, want to see clinical outcomes. And so it's being able to leverage governing policy-making bodies like that oversee the overstructure of the healthcare system, for them to spell out specifically, okay, every hospital system has to have bias training. Every hospital needs to do and monitor the data in relation to Black maternal mortality, morbidity. Okay, this is the next step, and that's really the biggest, strongest punch that I believe to get healthcare systems across the board to create policies, because within our departments, that is how our policies are created, is meeting those regulatory compliance accrediting bodies. And so those who have that power or those avenues to politically influence those bodies, that's how we would do that. That's how I believe we would do that.
Thank you. Yes, please, Ms. Lisa.
First, I would like to say that doulas are in, and doulas are very, very needed. And I love a doula. I love y'all. But doulas are a Band-Aid solution to a hemorrhage. And so I would like to say, in this current state of Medi-Cal reimbursement for doulas, which is awesome, y'all need the money, y'all deserve the money, you must remain independent. You must remain an advocate for your patient. They need you to not be kowtowing to the institution that is causing the harm. They need you to be fully independent and on their side. And that, I believe, should be a policy. Full insurance coverage for all birth options, true accountability, include community midwives as part of the wraparound services. Highland Hospital, Alameda County Hospital, is including community midwives in their rounds. We communicate with them regarding transfer policies and how to make them feel welcome when they come into the hospital and not ashamed for choosing a community midwife and needing a hospital transfer. I love the doctors and the midwives at Highland Hospital. I believe that every RN should take a doula training class because that's what changed me. That was I was humbled, and I mean humbled, by my mentor, Mama Shafia Monroe. Look her up. International Center for Traditional Childbearing. I love, love, love that woman. Every doctor should know the real history of midwives, and every doctor should know a midwife's scope of practice. I am a certified nurse midwife. I was trained to work in a hospital setting. I learned how to be a real midwife with my community midwives, most of which are certified professional midwives. They're not allowed to work in hospital settings, but baby, they know how to birth a baby. And most of what I learned, I became a really good midwife being in community with my certified professional midwives. That's just a few.
Thank you. Thank you so much for all of your expert opinions. I've heard a lot of great nuggets and some great information. We heard about having someone kind of be that person to help advocate, to be that stopgap person, and to slow down the room. You know, we heard about if you're feeling scared, you know, during delivery, that is not an appropriate response. You know, that something is going on. That may be a red flag that you need, you know, maybe a different provider or a different setting or someone to help advocate for you. And we also heard about regulatory bodies and JCO and how that can serve to hold some accountability, that there needs to be more than just bias trainings. There needs to be more than just check the box, but there actually needs to be some transformative change. And we also heard that doulas are so important to this work, and that they can be that advocate or help the birthing person advocate for themselves. They can be an addition to the labor and delivery team, and should be a supportive, they should be supported in that team and in that work, but that there also needs to be other things. I heard you say that, you know, we need to look even bigger and broader, but as we support our doulas and those changes that we're making, that we not stop just there. So I want to thank you all for taking the time out to speak with us. Again, you gave us such valuable information, and I just want to thank you for your time. So let's give them a round of applause.
Whenever you saw a midwife in the birth space, you also saw a doula. That was just kind of the dynamic and how things kind of flowed. You know, there was a black woman there supporting another black woman, bringing a black baby into existence. And that was powerful work then. And like Lisa Davis mentioned, during those times we had some of the better statistics because we had that full dynamic and that continuity of care. A woman who would carry another woman through preparing for pregnancy, being pregnant, delivering that child, and also caring for her through the postpartum phase. And that's that continuity of care, along with your community standing behind you, bringing you food and bringing you resources and things that you need to recover and heal fully as a person who just gave birth. So I just wanted to take a moment of silence to give honor and tribute to the midwives who come before us. And also to the mother, the panel. They were wonderful, the mothers. Yes, we need another round of applause for the mothers and the fathers. We've had some really powerful stories shared today, some very impactful stories that make me think as a future midwife, how do I keep on giving, you know, to this overarching, these overarching statistics, how do I make them better? Not only as a doula, but also as, you know, a mother myself, a future midwife and a community member. How do I continue to feed into this? So that's where I kind of wanted to start, giving that honor and tribute. So I want to also start with a question for you all. Can I have the doulas in the room stand? I'd like to be more familiar with the doulas. Yes. Amazing. And then the next question I have is, are there any people in the space that have used a doula with their birth. Awesome. Yes. Awesome. And now I didn't see too many hands go up with that second question, and that needs to change. So I hope that a lot of the things that we've shared on these panels help to impact and increase the numbers of doulas in the community. So I'll be leading this panel, and I don't want to take up all the space because these women have a lot of insight and knowledge and experience to share with you all. So the first question I'd like to start out with, and it's really to give you guys more of a landscape of what doulas actually do. Like, people know they need a doula, right? Some people don't even really know what a doula is still at this point, and the difference between a doula and a midwife. So just to give some context, I want to start out with asking, just based on a doula scope of practice, how can doulas help families? We'll switch it up, and I'll actually ask the actual question here instead of, spicing it up. The question is, what is the history and purpose of doulas, and how do they navigate their scope of practice to support birthing individuals and families? And yeah. Yes, and we'll have them introduce themselves before they get started. Brief interview, introduction.
Hello? Okay, it's on. My name is Antoinette Madelone, and I am a doula trained by Davon, so certified. But when you think about it, I've been a doula my whole life. And what a doula is, we learned earlier, it's a servant, a slave, it was, to a birthing mother. So the way I look at it for myself is mothering a mother. And you said, how do we navigate that?
Yes.
Okay, so for me, the way I navigate is I take the strength that I had that initially brought me here into this community, and I just build on it. And opportunities come, and today is an opportunity, so I'm just gonna continue to build from that. And then who is to find me will find me, and I'll find them.
Hi, everybody. My name is Shantae. I am a doula, and I'm also a workforce developer for a homeless program at Novato. But my business is taking care of birthing mothers. Absolutely love it. When I think about the history of a doula, is reclaiming that word doula and reinventing it of what we want it to be, because it does have somewhat of a dark history as well to it, but reclaiming who we are and what we want it to be. And we want to be in support of these mothers, these birthing people, however they identify. And then also thinking back to a time where there were no hospitals. How did women give birth? They had their families, their friends, their community, their tribe, who gathered around them during this time. And that's what we bring into this birthing realm, is bringing that feeling back of security, bringing back that sense of caring, knowing that somebody is supporting them who has the knowledge of what is birth supposed to look like. Birth can have so many twists and turns, and we have no idea where it's going to go. But with a doula by your side, you're able to rely on somebody who has a little bit more information that you might not. Someone who's able to work with the medical team. We try to be in partnership with the medical team and work with them as best as we can, because we are the birthing team, all of us, no matter what. Whoever's in that room, we are a birthing team, and trying to navigate that field with them and making sure that our mothers feel safe, confident, and cared for.
Beautiful. Great job.
Hey y'all, hey. So my name is Sia Davis, and you can see my bio in the book, so I won't go into detail, but I am a holistic centered birth worker. And so for me, my job is more of informing the mom based on data of their choices and inspiring them to become informed about their bodies and their baby so that they can be empowered to advocate for themselves. And then I'm there to be in the room based on what they decide their birthing plan should be for them and their family, And a part of that being holistic center would be to educate the family as a whole, not just the mom, because it really takes a community that you choose, and you have to be intentional about choosing that. I won't get, because I think one of the questions leads to that. So you do have to be intentional about choosing who is that community for you for your birthing plan. But really, as a birth worker or a doula, we can't necessarily speak for you in that room, but we can nod you in a direction to remind you of your birthing plan, because there will be times when your body is exerted temporarily. So we have to help kind of remind you and nudge you and say, okay, the doctor's saying this, but do you want some time to talk about it? And then they come back, and then we can talk about it. So that's what our role is as a birth worker, empowering the moms, because again, they're becoming mothers, whether it's the first, second, or third time. It's different each time, and we are there just to kind of remind them to trust themselves and their baby and their bodies.
Okay, strong and powerful answers. There's so much we could talk about up here on this panel. You know, I'm like, how do I bring it all in, you know? Because this topic is pretty heavy, and it's fully loaded. So we're gonna try to keep it, you know, kind of compacted, but also helping you all to understand deeper on how we really show up in these spaces. And so I want to share like a little statistic, and I don't have the actual number, but I know for a fact, and I've seen this statistic somewhere, and I will find the reference and share it at some point. But I found a statistic in the community doing research that when Black infants and mothers are cared for by Black providers, their rates increase. Their breastfeeding rates increase. Their desire to ask for pain medication in labor decreases. And in my mind, I can only associate that with, you know, the fear being taken out of birth while you have a support system in the room with you. And I see that from a doula who has been in the hospital space a lot of the time through COVID, before COVID, and I've seen how things have shifted as a result of COVID. And then also as a student midwife who primarily experiences birth from a non-medical standpoint in a home birth. And so I think just as a doula, the education that we provide is so paramount, because a lot of that education helps people to prepare for what to expect. A lot of that fear comes from like, I don't know what's coming next, you know? I'm pregnant, I am, you know, they're saying this and this is going on. And the more that that person knows about that scenario and how to navigate it, the more empowered they feel to walk into that space with their head held high, with that white coat syndrome kind of, you know, taking a back seat, because they know what they're about to walk into in some regard. So doulas are really there to, like I've heard this term, bridge that gap between that birthing person and that provider, and them getting that support and education that they need to have the birth experience that will help shape the way they tell their stories in the future. And that's important. And so my next question to the panel is, what are some practical ways doulas can educate and empower birthing individuals to navigate healthcare systems, ensuring they have the information needed to make informed choices during the pregnancy, birth, and postpartum?
So I think it's really important to educate the families on their choices. Are they going to have a midwife? Are they going to have an OB attend? Are they going to do a home birth? They have options, and they should be aware of those right away. And that they can also pick their medical team. So I've learned this from from clients that I've had, walking into the birth room with them, and I get to meet their doctor for the first time who they've been working with. And I'm going to tell a quick story. So with this particular doctor, this was at Good Samaritan in San Jose, and I had a doctor shove me several times who was a white doctor during the pushing phase of my clients. This was traumatizing for me, and after that, I was like, I'm gonna quit being a doula because I can't mentally do this for myself. And I'm trying to hold my composure in order for her to have a good experience, and I'm being shoved. So now when I go and talk to my families, the first thing I ask is, do you like your doctor? Do you like the medical team that you already have? Because you have a choice to change them. You do not have to stick with the person that you were assigned to. Even when we're in the birthing room, if you have a doctor's, because we never know who's gonna be on staff. Right. Sometimes we don't know who's gonna show up in that room, but letting them know, put it on your birth plan. Do you want a woman team? If they have midwives, do you want a midwife? Request that and put that on your birth plan right away. That's how I educate and empower my mothers right away. Let them know that they have a choice to say, I'm gonna talk to the charge nurse. I do not want that nurse. I wanna talk to the charge nurse. I wanna change the doctor who's been assigned to me. That's where advocacy comes in. That's where the empowerment come in, that they have these choices and they don't have to stick with these. Some of these nurses are absolutely amazing. These doctors, amazing. I absolutely love some of them. And some of them, I'm like, we need a switch. Something needs to switch. So just providing that education to my families is very important to me. Also, childbirth education, making sure that my families have access to childbirth education, because I can't teach all of that. It's impossible for me to teach something that takes 6 hours and multiple days. So making sure that they have access to know what are their choices in the hospital, and also just medical procedures. And then we can go into more depth during a prenatal visit and talk about that. Also, I'm more than happy to go with my clients to the doctors and actually meet their doctors and making sure that they're asking the right questions. And in the birth space as well, making sure that I'm asking the right questions, because sometimes my family might not know what questions to ask. So just giving them the power through words. Words are powerful. And making sure that everybody understands, like, this is a learning process for all of us. We all have to be adjustable as well and flexible, because birth is, we don't know where it's gonna go. So just understanding the choices that they have.
For me, with my clients, I think it's really important to build trust with them first, so they trust me going in, and I'm gonna fight for them. And I just wanna say really fast, I hope I never get shoved, because it might be a different outcome. But no, but really building that trust so I can not fight that fight for them, but they know I'm going in with them. Because you can have all the family you want, but to know that, because building that trust can kind of make you part of their family. And you can be that family member with the voice, the educated family member that gives them or reminds them of their choices through this journey. Because that's what it's all about, is having choices. Life, birth, and Davon had said not too long ago, life is like birth. It's ebb and flow, or pregnancy rather. So you have to go through that and see them through. So that trust builds it, and to see them through the whole birthing process, and even after.
So all the things that they said, in addition to that, just helping them start off by understanding that in the interview, I might not be the doula for you. Like, I'm holistic centered. You might not need that, and you might not want that. But so I'm empowering you first off to understand that it's important for you to be intentional about even the advocate you're choosing. So the first empowering I'm doing is, I might sound good, you might like what I'm hearing, but your spirit might be like, oh, she pushing me a little too hard. I need to be babied a little more. I'm not here to mother you, but I know a doula that will. You know, I'm here to push you past that to be ready to mother this baby. So that's how I'm gonna treat you, right? But there are doulas that will hold your hand a little more, and I got them for it, and you can go interview them too. So I'm gonna empower you from the beginning to understand that you might not need to choose me just because I'm the first birth worker that you come into contact with. And on top of that, you should be doing the same thing with your birth team. That doctor that was assigned to you, don't trust him just because he's wearing a white coat, because he's human too. And he's been taught in a system that is literally killing us. It is showing the data is showing that they don't understand our needs. So I want to stress that to them, because unfortunately there is just a blind trust to this system that's doing their best, but they're still failing us. So we have to become our first doctors as the birthing parent, and helping families to understand it, because a lot of families just have been disconnected from the birth working, so they will not be encouraging. They'll discourage the mom or the dad, and then it creates a lot of internal chaos that could be saved if we all, even if you're not a birthing person, being a grandmother, an auntie, just being an encouraging person, being informed together, ask questions about their doctor's appointment, research together with the mom and dad. It's a community, it's a family event. It's changing everyone's life. So for me, I'm educating on that standpoint that we should be a united front. And those that are gonna bring the negativity, you have to learn how to create the healthy boundaries so that you can be supported in the best way.
All right. So with that being said, I know we're on, some time restraints, and like I said, these questions are loaded. This whole, this whole topic is something we can spend the whole day speaking about. And so I want to kind of close out this panel with sharing that Solano Hills has started a training program in Solano County. And just after hearing all of these stories, all of these experiences, again, I started off by saying, how do I kind of like help and involve, the community in changing some of those outcomes that we're seeing? And the first thing that comes to mind is, get more community members involved. Mm-hmm. Bring awareness. And I think that this event is helping to do that, helping to bring some of the people who need to hear this topic to the table. We're talking about doulas, birthing people, midwives, doctors, OBGYNs, pediatricians, the whole birth team. And so that's a really great, start. And I think we continue this work by continuing to spread the word and the knowledge and the understanding that we have a community of doulas here. All of us in here have the potential of being doulas. And I've heard it. I've heard it from personal birthing stories, like my mom was my doula, my sister. Also understanding that there are people who birth with different experiences. We have people birthing babies with disabilities and not having certain resources. And just to give you guys some context, I've just trained 14 new community members in the community. Yes. They all stand amongst you. They all, work and live and play in the same community. And these people, they come from different backgrounds. And just hearing one of the stories, we have an actual ASL, doula who has been trained. So it's like, we need to know she exists, we need to know she's out there. And so we need to continue to come together in, in spaces like these so we can know who each other are. So with that being said, I think I'm gonna close out the panel and allow for.
So I just wanted to add that I'm not too sure if you guys know, but Medi-Cal did pass the Medi-Cal doula benefit that started last year. So anyone that has Medi-Cal now has access to a doula. Yes. So if you know anybody who is pregnant, they're more than welcome to ask the provider about a directory of doulas so they can contact someone. This person can help them through prenatals and go to the doctor with them if that's something they offer, go to just, being there for them, advocating for them, making sure that they're prepared, going to their doctor's appointments, if they need to go get vaccines, any of that stuff in the prenatal phase. And then actually attend their birth, so then you actually have support in the birthing space. And then postpartum, up to a year, you can have a doula support you and come to your home or do phone calls or making sure that you're going to your doctor, making sure that your mental health is well, and just being a support of you during that phase. This is a wonderful benefit that we're very excited about, and I'm so happy that more people are gonna have access to a doula. So if you have a friend or family, let them know.
I wanted to have my daughter natural because I was well aware, I worked within pharmacy, of the effects medication has on you and your child coming out. A lot of the complications from what, at least in my mind, were from the epidurals, from the pain that can happen when you get that huge needle in your back. The numbness that can happen to where when you're pushing the baby out, you have increased tearing because you're not feeling what you're doing. I'm lucky I come from a really great family that I heard stories of how my great-grandmother gave birth holding onto a tree with no doctor. So I knew my body was fully capable of having a baby naturally, and yet society tells you that that's not possible. Knowing most of us here are Black, we didn't have doctors. We had ourselves to rely upon. We were 9 months pregnant in the field giving birth with lashes on our back. So I knew in this day and age, I can have my baby from my tiny little body naturally. And so even up to when I was giving birth, I had to say, no, I don't want that, no, I don't want that, no, I don't want that. And that's not the scary part. I mean, I had her, it was great, 6 hours. I had some African drumming music on, I was in my vibe, you know. And the interesting part, the pain that was the worst was not pushing her out, but it was after giving birth when they push your stomach back in. And the nurse had no sympathy. So that was the most excruciating part. It wasn't the baby coming out, it was the nurse that came and pushed down on me every few hours. It was terrible. That was the worst part of it. And then next day I was up running around and cooking and doing everything else because I had her naturally. Your body, at least from my understanding, adapts better naturally. So that was my first story. That it was really beautiful. I'm very proud that I was able to do that. The second one is not so good. And I've never shared this, but I'm just going to be honest because that's what we're here to do, is tell our stories. I was working at my job in pharmacy, and I fainted leaving at work. Went to the hospital, found out I was pregnant, didn't know. And this was at Kaiser, and they said, oh, you're pregnant, okay, just go home. I didn't get a scan of my stomach, nothing. I was not feeling well. I was feeling very faint. My stomach was hurting. I tried to get an appointment. There was nothing available for next month, 2 months away, and I needed to be seen. And the only place that had availability, although they are demonized, was Planned Parenthood. I was able to get in the next day. I got a scan, found out I had a tubal pregnancy. I was immediately sent to have surgery and and I actually lost one tube for that reason. And the sad part was I woke up after, and they said, well, we didn't know if we wanted to give you grief counseling because you were at Planned Parenthood. And I said, well, this was the only place that would take me. And thank you to the doctors that spoke up about this. And that's what gave me the strength, because I was made to feel guilty for being there because of the stigma of a Planned Parenthood. And I just want to speak to, we need resources everywhere because we need these different avenues. I would not be sitting here alive had I not gotten that appointment the next day at this agency that people demonize, because it gives the woman the right to choose. And I grew up Catholic, but you know what? Your body is your choice between you and God. And they are trying to stop women from having that choice, even in medical situations, meaning I would not be alive right now if I was in a state that didn't allow that to happen. So not to make it too political, but as I heard today, our job as policymakers is to keep those things intact. So I just wanted to share that because I was inspired by what I heard today. And so 2 different stories, and you hear about all these, oh, you lost it. It can happen to anyone. And I really wanted to stigmatize needing to have emergency services, have Planned Parenthood, have a choice for that matter. If we didn't have those operations in effect, I would not be sitting here with these other Black mothers telling my story, and I will be a statistic, and the story would be that I went to Planned Parenthood to get rid of my child. So thank you.
Kirby, can you repeat the question again? Because it was loaded.
Hello? Okay, great. One, let's give it up for Princess again. What an amazing advocate and a leader. It is the lived experiences of Black women that's going to really shape policy moving forward, so thank you. So the question is, as mothers, could you share your birthing experiences, including the number of children you have, and reflect on how those experiences shaped your views on maternal health in the Black community? Also, if you could just highlight your actual experience in the process, did the support of a midwife or a doula play a role in your journey? And everybody got 4 minutes. I'm timing you. If I hold up a little. It's just that I want the people to get the game and the wisdom. Thank you.
Hello, everyone. My name is Karina Cook. I am part of Suisun City Environment and Climate Advisory Committee. Thank you. I have 3 beautiful children. My eldest just turned 8. His name is Essex. And my daughter, Javia, who I brought with me, is 5 years old. And my youngest is another boy. He is 2. So as you guys can tell, my hands are full. My experiences were pretty much all different. I gave birth with my eldest at North Bay. That was a very interesting situation to be in. I definitely, coming here and hearing everyone experience, put things into light because I didn't have a really good experience with North Bay. Unfortunately, I didn't feel like I was advocated with. There were a lot of things that I feel they didn't tell me that I should have been aware of. At the time, I had high blood pressure and I didn't know. I had no idea what that was and what could cause that, and that it was actually something that was more likely for Black women to have. So I went in it very blind, and I would just remember giving birth and going into labor, and they actually didn't tell me that. They just told me my blood pressure was high, and they tried to keep me calm. Some of my family members knew in the room, but no one wanted to, I was panicking, basically. So they tried to keep me calm. And so that was the first incident. After I had my son, I didn't know that there was anything, preeclampsia, eclampsia, that was not a thought in my head. No one educated me on that. My experience during the process was traumatizing. After birth, I just remember, I wanted to breastfeed my child, but then, new mother, I was like, well, let me figure it out. I maybe want to give him a bottle. And the nurse told me that that wasn't an option at North Bay. I had to pick and choose. And at that point, I was like thrown off, because I'm trying to figure out what the best method is. I'm tired. So that just gives you a understanding of like the feeling going through this process. So fast forward to my daughter, I had another situation where I had preeclampsia. I had to deliver early because I was having high blood pressure a few weeks before the delivery. And I delivered early. I did have my family member, I call a doula. She's been there every pregnancy because I was kind of scared to go through this alone. Of course, my husband was there, but during this process, I felt it was very important to have a doula there through all my pregnancies because I felt like at least they'll also be there to advocate on my behalf because I wasn't aware of everything. I went through the preeclampsia with basically my first child. We didn't know what it was because they didn't tell me, but the last 2, I did have it. My blood pressure went as high as, I was just looking at it before, 215 over 124. And I had a headache for 12 hours, couldn't get it to go away. When both children, I had to stay. I gave birth and I had to go leave them after breastfeeding to go back to the hospital for a week, and then the second one, a week and a half. So I had to be away from my children, newborn. My husband was amazing with taking on the responsibility to, just go all in with the kids. So it was very traumatizing for me. Because of that, I am not able to have children past that because it will be something that is harmful for me or the baby. And during that process, I had to that was something that came up if, you have to pick and choose at this point. So that was very scary for me. And during that process, I felt like, yes and no, I had the support in the hospital. I think it could have been better going into the hospital after this. With my third child was very traumatizing because they weren't helping me out as much as they could. And so, yes, that was my experience with it. And but I'm happy to be here, and I still have 3 beautiful children.
Thank you for sharing. Let's give it up because you survived that, and your children are so beautiful. And shout out to the supportive partners out there. You good on the question, sis? You remember it?
Yes, I remember the question. So my name is Keela, and I actually have a 6-year-old little girl. I live here in Sassoon, but I work at a middle school in Vallejo. My birthing experience, I did go the traditional way of just standard North Bay. For me, I did actually have high blood pressure before I ever got pregnant. So going into my pregnancy, first things out of their mouth are high risk. Didn't want to put me initially on high blood pressure medication because of my pregnancy. I worked 2 jobs my entire pregnancy up until 2 weeks before I went into labor. And because of my high blood pressure, they started me on non-stress tests. Twice a week for the last month of my pregnancy because I said, my baby has no space. She was essentially running out of amniotic fluid. She was at 5 pounds, 8 ounces bigger than they expected her to be. Small sac, big baby. I was scheduled to be induced. She came early on her own. Baby, it's that Gemini in her. Woo! All right. Woo! Girl. Very much an interesting experience. Spent the entire day in the pool swimming. I get out, mom cooked a good dinner. Shower time, I pee on myself. Yeah, no, mom, wake up, I think my water just broke. And I went from not dilating at all to sending both sides of the family home to go to sleep, to my younger brother calling my parents and dad like, y'all need to come back up here. My mom is there, dad is there, both on opposite sides. And the only thing out of my mouth after I push her out is, Mom, did I tear? I was ready to get up out of North Bay though. I want to sleep. The baby is asleep. I've got visitors in and out of this room. 30 to 45 minutes like clockwork. Can I have a break? I don't need to see the lactation consultant. We good. They don't listen. I'm ready to leave North Bay. As all of us mothers know, there's a hearing test. My daughter didn't initially pass her hearing test. They attributed it to, well, we don't suction the babies anymore, so we'll give her a couple of days, we'll let everything dry out, bring her back, we'll do another hearing test. She eventually passed, only for less than 2 years later, my daughter to lose her hearing. So she is deaf on the range of severe to profound hearing loss. We tried hearing aids for about 4 months. Didn't help, they were really cute color. And so the option was cochlear implant surgery, or your daughter just won't hear. My baby loved music too much, so we opted for the surgery. She won't shut up now. I guess it was worth it. There you go, baby.
Hello, everybody. My name is Cassandra James, and I am a candidate for Solano County Supervisor, the District 1. Thank you. And I have 2 beautiful boys, Chase, who is 9 years old, and Kai, who is 3. and their birthing stories or my birthing stories with them are completely different. With Chase, we started off, my insurance is Kaiser, I'm gonna be completely honest. So with Kaiser, I started off in Kaiser Oakland because it was close to my job. In Kaiser Oakland, they have a more diverse team there where they sat with me and helped me come up with the birthing plan so that I can have a doula and a midwife for when Chase was born. Yeah. So when I had him, they both were born at Kaiser Vallejo. So when I had him at Kaiser Vallejo, they guided me on the tour of the facility, the maternity ward. Also, I got to meet with the team, and it was really important for me to speak to the fact that I need a culturally competent team. So with Chase, although Kaiser sent me home 4 times because I wasn't dilated enough, this is where the clash of hospital and families come together. That last time, my grandmother was like, y'all ain't about to send her home. We need to give her time to dilate. We need to give her time to breathe through what her body is going through. And she looked at me and she said, where are the black people that was supposed to be helping you? I was like, we're in the triage, we have to get there. And she, she was upset. But with that advocacy, she truly advocated for me and surprisingly stuck to my birthing plan. So when I was able to give birth to Chase, I only had a doula and a midwife in the room, which really helped guide me through that process and make sure that my body was naturally doing what it was supposed to do. On the flip side, but afterwards, and I would just want to say the aftercare again, because I know we only talk about the birthing process, but this is a whole process, pre-birth and then the afterbirth. And the after process, it was really important, again, to have that team that was culturally competent, that didn't come in every 30 minutes, that allowed me to breathe, that allowed my family to adjust to what just happened, but also talk about my options. And there was an incident with one of the nurses who were like, you have to breastfeed. I'm like, I don't feel comfortable with breastfeeding. I need to be taught how to do this. And the next nurse, who she was with me the night of his birth, she said, you have options. You could breastfeed and you could bottle. It doesn't have to be one method. And you have to figure out your relationship with your baby. So really being guided through this process, and also having her include my grandmother is a really strong force in my life. And having her include my grandmother and my partner in these decisions and process. On the flip side, Kai. Kai was born at the onset of the pandemic. So when I was going through the process, they told me that I would have to give birth in the room by myself, that I would not be able to have anybody in the room with me. And I have friends in the medical field and friends who do social justice work. They said the word that you need to use is advocate. You need to have an advocate in the room with you, so that way you do not have to give birth by yourself. So with Kai, I requested an advocate to be in the room, and my partner came with me, and and they were like, well, we're gonna have to do a C-section because we need the beds, because we don't know what's going on. Yes. And again, going back to that advocacy, saying the body needs time to go through the process, and kept pushing every day, because I was in the hospital for a week before he came. And the next nurse, who she was with me the night of his birth, she said, you have options. You could breastfeed and you could bottle. It doesn't have to be one method. And you have to figure out your relationship with your baby. So really being guided through this process, and also having her include my grandmother is a really strong force in my life, and having her include my grandmother and my partner in these decisions and process. On the flip side, Kai. Kai was born at the onset of the pandemic. So when I was going through the process, they told me that I would have to give birth in the room by myself, that I would not be able to have anybody in the room with me. And I have friends in the medical field and friends who do social justice work. They said the word that you need to use is advocate. You need to have an advocate in the room with you, so that way you do not have to give birth by yourself. So with Kai, I requested an advocate to be in the room, and my partner came with me, and and they were like, well, we're gonna have to do a C-section because we need the beds, because we don't know what's going on. Yes. And again, going back to that advocacy, saying the body needs time to go through the process, and kept pushing every day, because I was in the hospital for a week before he came. And then decided that one of the nurses, a woman of color, she said, you can choose your team. So having her inform me of that, I said, I want the next team, because this team hasn't been treating me so well. And with the next team that came, we waited a day, waited for the next team to come before moving forward with the C-section. But it was great to see and have the advocates that looked like me in the room, from the Black anesthesiologist to the Black nurse to the Asian doctor, and we even had a South Asian midwife in the room, although it was a C-section. But it was having that power to say, this is how I'm going to move forward in this birthing process. And that's all the 1 minute. Thank you.
First of all, let's give it up for our panel for telling their stories so effectively. I love the power of Black women. Our lived experiences, again, is what's going to really change policy in this country. So thank you all. And so one reflective question that I think would be helpful, and you all can jump in and answer how you want. So reflecting on the health disparities Black women face during pregnancy, could you share how your healthcare experience influenced your advocacy for maternal health care? Also, as mothers and community leaders, what positive mothering experiences inspire you to be a leader and be a model for your children? Yeah, woman in Asia. Yeah. So wrap it up and inspire the crowd.
Yeah. I think the most important thing is to realize environment. When you're giving birth, you're bringing something into this world and being cognizant of what's around you in this world, right? Being fully conscious in these moments that create other moments. I think there's always this false narrative of Black motherhood, and they're mean, they're stressed out, all these stigmas that come from social justice inequalities. We are not allowed to be soft and happy and be in these other spaces because of systematic things outside of our control. So I think being mindful of that change that we can do automatically within our environments is going to be the most important step in moving this, our people forward, right? Having our Black fathers present, recognizing that we do need our men. We cannot do it alone, and this false narrative that we have to is absurd. And I'll leave it at that.
Can you run that question one more time?
Well, you had the baby, so you birthed it. So how's it like being a mother? And also, how have your, again, reflecting on the health disparities, you all, 4 of you talked about the healthcare system. So how do these experiences influence you to be an advocate?
It's amazing being a mother. I think that although those experiences happened, it also made me appreciate so much more, honestly. And that's actually has helped me be able to help other people. So even talking like this, and when I'm talking to my family, when I'm talking to other young pregnant women, or my sister, she doesn't have children, but her seeing my experiences, me being able to walk her through that before she even gives birth, you know, before she even gets to that point, because I think it's an ongoing conversation that needs to happen, because you don't know when this is going to happen to someone, and just to be able to make them aware, not size diapers, not, you need this for your baby shower, but listen, these things happen. These things are serious. And when you're choosing doulas or midwives or ways for you to feel comfortable during pregnancy, whether you're giving birth in water or you're listening to certain music, ask a lot of questions. Have someone there to advocate for you, because I think that that's the biggest thing, is having someone present. And I love that Cassandra said advocate, because I think it's really important to have someone there as a second opinion to, because we go into these situations and we don't know it all. So having someone there to be that second ear to help you through the process. And so I'll continue to be able to talk to people about that and, just educate people on my experience so that it can help them in their experiences.
For me, I'll say I was lucky to have the mother that I have. The mama bearness is strong. Yeah. And so having my daughter and finding out that she had a disability, for me, it was go hard or go home. So doctor's appointments, ear, nose, and throat specialists, children's hospital, audiology. My mom has been there. And so that kind of gives me the extra push and fight to let me know, like, okay, mom is in my corner, mom is on my side, so whatever decision I decide to make for my daughter, I know my mom is gonna support me. And I will say, with my daughter being deaf, you start to find out a lot of things that you never really thought about. What resources are in your area for your child to tap into? When my daughter started school, I wasn't aware until after the fact, there's no deaf and hard of hearing resources in elementary. So my daughter goes to school in Vallejo. She'll then be transferred back to Fairfield School District for high school, because then Vallejo doesn't offer it for high school. Sign language, interpreters, special phones, special devices for her to use at school, changing permanent equipment out, every couple of years. That's not something you normally think about until you're kind of thrown into that. So for me, I'm going to ask the hard and difficult questions. The doctors are going to get one or the other from me. You can pick. But when it comes to my daughter, there's no question. I'm going to do whatever I need to do. Anybody in my way? Good luck.
When you say go hard or go home, what came to me was stay ready so you don't have to get ready. And it is the education and awareness about what's happening within these various institutions. And we know historically, we have, and when I say we, historically policies have been put in place that have historically excluded communities of color. So being a mom, I often look at my sons and I tell them, like, go ahead, go try out for the team, go do this, and helping them guide them through the process. But I can't do that if I'm not willing to do it myself. It's an accountability session when I'm looking at them. I'm looking in the mirror. So, and it's very important when I come up for air, because sometimes we're so in survival mode. When we come up for air and we look at the disparities, we need leaders that look like us and that have the same experience as us, that are able to move and push and advocate and be unapologetic when pushing policies forward, because we have lived it, we know we've lost people to it, and we will dare not feel that anymore. So it's really important as we are sitting in this room together, we're not in survival mode, we're in a safe space. We look around at each other and just making sure that, do our leaders look like us? Do our leaders have the same experience as us? Are we holding them accountable and pushing the policies forward? Because there's no way, especially in Solano County, who dies on the sword of being one of the most diverse counties in California, if not and have one of the blackest counties per capita in the state, that the highest infant mortality rate, Black women suffer that. So it's really important for us to take that time and really have these conversations. But if we stay ready, We don't have to get ready.
Come on,
And we
preach.
make sure we bring everybody with
Preach.
us.
Let's give it up, y'all. Let's give it up. Let's give it up for the Black Moms Matter. That was our dynamite panel. Thank you all. I got gamed up. Powerful. Your lived experience, again, is going to transform this whole field. Thank you.
So welcome. I'm so excited about this panel because oftentimes we focus solely on the moms and we don't get the dad's perspective, and we know how important fathers are to this conversation and to the families and to the lives of the babies. So let's just give a round of applause to these dads that are joining us here today. So first, I'm just going to let you all just introduce yourselves. If you want to give your name and just any introduction that you want to give. We'll start with you, Cindy.
Oh yeah, Sundiata Cummings, father to Kai, 7-month-old boy over there in the back with his mama Isabella. Yeah.
All right, my name is Richard Taylor. I'm just a father, and I'm a father of 5, stemming from talking about first 5, right? You turn your mic down just a little. Thank you, brother. Stemming from ages 27 to 6 years old. So this is not my first rodeo, so to speak, right?
And you're not just...
My first rodeo.
All right, so can you tell us a little bit about your birthing experience, Sundi?
Yeah, honestly, it was actually really great. I guess people would call it like textbook. Had a great community behind us and with us, from a doula to doctors to even a program for pre-birth education. It was a group called the Embrace Program in San Francisco. So that was really great. We had a team that talked about education, talked about our fears, our wishes, our wants, desires, how to work through some of that, and of course, some of the issues with being Black, in hospitals and whatnot. So through the process, we learned a lot, had a good team, built a little family as well. Had a great experience in the birthing room. I think it was like a 15-minute push, playing with music from our baby shower, from like soul, funk, R&B, Afro beats. So it was a good time in the birth room overall. So, yeah.
Everyone's listening to that 15-minute push time. It's like... So I heard you said you gave, or your wife or your fiance gave birth in San Francisco. What made you choose the Embrace program, and how did you hear about it?
Yeah, so we found it just randomly online. We were looking for basically a Black OBGYN. The ones locally were either booked or there was a wait list and we couldn't get in. We met with a non-Black OBGYN, but we weren't really heard or listened to. So like, well, we might as well just go to SF and get some Black folks and be in a group where we can learn with other people in our cohort. So that's how we kind of made our journey. We traveled there twice a month for the program. What else? Yeah, that's really about it. So it was really just getting around folks we were comfortable with to build trust and have a safe space for our journey.
And so you said like you were also feeling like you weren't heard or listened to, which we hear quite often of our moms being the same way. Do you think, or have you thought about how your birthing experience would have been different had you not gone to San Francisco in that program?
I mean, I haven't, but I would imagine it'd be a lot more stressful. I know we're really in a good space with our group, especially meeting months in advance and just knowing our doctors well, knowing our team well. Walking into a place where we had also other Black nurses as well, so didn't really think about the negative because we were already in a great space. But it could have been, a lot worse. I know things can really change or twist in the birthing room, delivery room. So definitely we're fortunate.
Yeah, me too. I'm happy for you because we hear so many times of the negative birthing experience when really we should be hearing about it should be more positive birthing experience. And if any negative should be like the outlier, And one thing that we do hear a lot of is that if the birthing team or whether it be a midwife, OBGYN, is of like a Black midwife or OBGYN, that actually does have some protective factors in the outcomes. With that being said, do you think, can you think of any reason why that would be? Like you naturally, you wanted a Black OBGYN. Can you go into a little bit about why you felt that way?
Yeah, I mean, we knew some of the stories from others, whether it's in person or online, that they've shared about their experiences, and so we just knew that that'd be a better space for us, especially considering just giving birth in general, the dangers of that, and having someone who can actually help us get through that journey. So it was very key to find someone Black to have a starting point of safety and trust in our journey.
Thank you. And would you also like to share one of your birthing experiences?
Well, I think it's very interesting because for a father, it actually, in my situation, having 3 separate mothers, it all depends on the mother that you're dealing with and where they're at mentally in society. I've had my first kid's mother, she was very Afrocentric and wanted to do everything Black, right? My other 2, they were just like, we're just gonna do the traditional, we're going to Kaiser, et cetera, and, hopefully this works out. I think for my experience at the end of the day as being a nurturing father, I think it's very important to be able to listen to the mother and be able to support whatever her wishes are. At the end of the day, I think, once we do that, we instill a better pregnancy in the mother. So my train of thought is listen to the mother and support what her wishes are to the best that we can. Yeah. So.
Thank you. No, that's so important, and to be that, sometimes do you feel like you have to be an advocate as well, listening to what she says, but also helping to highlight her voice or get her voice to be heard in the room?
Yeah, I mean, at the end of the day, she's the one that's physically going through, through the trauma, right, of pregnancy, and it's a very positive trauma, and so I think spiritually, mentally, and physically, it is very important to listen to her and to be that supporting factor. And I think a lot of times, as men, we fail to do so. And so I encourage men to, yes, she's going through a lot of emotional stress, hormones are changing, her shape is changing, everything like that is going on, and she's not feeling her regular self. And so a lot of times as men, we kind of get into our feelings and take a lot of things personal that could be very little, but if we're not really tuned into her, we'll take that little situation, like as an example, she says, hey, I want you to take out the garbage. And we're like, okay. But she didn't specifically say, I want you to take out the garbage now, right? Right, she leaves it wide open, right? So in our mind, it's like, okay, we'll get to it when we get to it. The 49ers are on, or the Raiders are on, or whatever the case may be, right? But because she's going through what she's going through, that irritated her, right? And so something as small as taking out the garbage can be a big blow up. Now we're bickering between, not taking the garbage out on time, et cetera, et cetera. Well, all that negative thoughts and all that negative energy affects the baby, right? And so what we want to do is we want to kind of calm ourselves down as men and take ourselves out of that narrative of I'm still that man and, that rah-rah, masculine energy and, what I'm saying, and just kind of breathe with her, so, yeah, so that's where I'm at with it.
Right.
Yeah.
Right.
So. Right, wrong, or indifferent. That's how I get down.
So you said you have 5 children, and
Yes.
I'm sure that over the different births, you have learned how to listen and how to not take things personally. But for someone who this may be their first birth or first baby, can you give any advice of what got you to that point of taking a step back and knowing that it's about the baby and not adding stress and all of that?
Right, correct. even, you know, I've been through it 5 different times. I'm not gonna say that I'm perfect, right? You know, we're human, so we're still gonna slip up here and there. But I think what the suggestion that I would get is, as a man, I think we need to understand that we wanna be the change that we wanna see, right? So we wanna advocate, you know, good, healthy pregnancies. So what does that entail, right? So what it entails for me is being able to reach out into the community and talk to other fathers, talk to other uncles, or fathers who are, you know, uncles, or just folks, you know, that you can just network with and say, hey, this is what I'm going through. Can you lend any advice, any healthy advice, you know, that will help me be able to go through my journey more successfully. So really, I think at the end of the day, it's really looking inside yourself and saying, hey, I want this to be a healthy pregnancy. I want this to be a healthy birth. And I know I'm not perfect. And what can I do to, you know, make that be a reality? So really just searching for help, understanding that, hey, I'm just a man. I don't have all the answers. I don't know. I'm not perfect. So what can I do to try to find out, you know, what can help me? What kind of information? So like groups like this, you know, conferences like this are things that I encourage, you know, up and coming fathers to participate in, because I think if we had a whole bunch of men up in here, even though this is a women's conference, right, we're getting a lot of good game. You know, we're starting to understand a woman's perspective and knowing. So I was raised by so I didn't have a father, just real quick, and I don't want to be long-winded, but I was raised without a father. So knowing the importance of having a father, I said to myself, I don't care what the situation is with the mother, I'm always going to be an involved father to my children. And so I think, God, it's emotional. Having a lot of aunties around, and because I didn't have a father, my feminine energy was a little more tapped into than my masculine energy. I was able to, and this was one of my games in high school, you know, talking to women. I had a little more connection with them because I was raised by my aunties and my sisters and whatnot. So I was able to, you know, hey, relax and give you that good shoulder massage and not feel no type of way about it. But it's good. There's a couple of gentlemen in the background, you know, sitting in the back, standing in the back there. And if we had more men to be able to listen to you guys and listen to your concerns, I think we'll be a little better off.